Today we're going to talk about clinical examination of the cow. I'm at Mpemba Dairy Farm near Blantyre in Malawi, and I have Rolex who's assisting and our lovely cow called Lucky. So one of the first things we do when we want to know if a cow is sick is we ask the farmer. We ask the farmer, is the cow eating? Because that's the first thing that animals stop doing when they're sick. And we'd also ask about milk production, because a cow's milk production will reduce when they're sick. And then we look at the cow for obvious signs. So when you turn up to see a cow, she normally turns around to see who you are, because cows are always curious. So let's go through how we look at a cow and what we look for. Always carry out your clinical examination on the left side of the animal. So here we have our cow. The first thing I see is she's chewing her cud. So a cow normally chews her cud for about 10 hours a day. So it's part of the digestive process. So that's a good, healthy sign. When I look at her nose is nice and wet and it's got clear mucus. I look at her eye, and her eye is nice. She's getting very shy. Her eye is nice and bright. So it's got a glisten there. It's not sunk in her head. And when we look at her ears are up, she's alert. And when I touch her ears are nice and warm. We then move back towards the body, and what we have is behind the shoulder, we have the lungs. So I'm going to repeat my drawing here of the lungs. So this is where we find the lungs, this area here. They're quite small. You'd imagine the lungs in the cow is really, really big. But the lungs are actually very, very small. And if you have an animal with a respiratory disease, they start to breathe a lot more quickly because of the damage to the lung tissue. A healthy animal will normally breathe in and out for about 15 to 20 times a minute. Animals with a respiratory infection will breathe maybe 30, 40, 50 times a minute. But you also have to be careful, because you can have an increase in breathing when it's very hot because of heat stress. And so, of course, one of the most important things we do when we're examining an animal is we take its temperature. And that is covered in a separate dairy school film. We now move from the lungs back to the rumen and the stomach. So I'm multitasking here with my pens. So I'm going to draw the rumen. So I didn't make it quite big enough the last time. So here we have the rumen. It's really big. This is the first stomach of the cow. It is where all the food goes when the cow starts eating. And it is about 150 litres in size. It's really big. So the rumen is this area here. And there is a muscle, I should draw the muscle, there's a muscle here that divides the lungs from the guts. So when a cow is eating, the first thing we see is this area here, which is behind the ribs and in front of the hip here. This area here is where, I now know why Picasso had problems. This area here is what we call the rumen fossa. And you can see in this animal, the rumen fossa is actually, it's level with the cow. And when I push in here with my fingers, I can actually feel the rumen contents. So this animal has been eating very, very well. If you have an animal that hasn't been eating well, there's a hollow in this area. If I push my fingers in here, I'll be able to feel the rumen contractions. So the rumen is like a cement mixer. It basically contracts twice a minute. And you can feel those contractions when you have your fingers in here, because it'll start to push them back out again. Hello, girl. And so I can feel that happening now. So the rumen is working perfectly well. And before I forget, always check for ticks. Tick-borne diseases are common in cows. Now what we're going to do is we're going to go to the rear of the cow. So one of the things that we'll want to know is what is the fecal consistency. So a cow normally will produce a cow pat, and the cow pat will be firm, a bit like a cake. If you get diarrhea, then it tells you there is some digestive upset, and this cow is just about to pass manure, which is actually perfect because it gives us an indication of what is fairly normal. So if you look at that manure, you can see that manure, it has got a good consistency, so there's no diarrhea there, so that's good news. Underneath the anus, we have the vulva, and that's the entrance to the uterus. And after calving, we can get metritis or retained fecal membranes. So with the retained fecal membranes or retained placenta, we often see the placenta hanging down from the back of the cow. Sometimes you will see the tail is up a little bit like this, as if she's trying to strain to pass the placenta. The one thing that normally happens is when you smell, you can smell the metritis. Metritis is a horrible smell. And metritis normally happens in the first week after calving. A retained placenta can happen from 24 hours after calving. So we now move from here and we move to the udder. And of course, the udder is where we get mastitis. And to check for mastitis, we need to strip the milk from each of the quarters. I'm not going to strip the milk from this cow because I don't want to upset her. But what you can do is you can feel the quarters, and you can feel the quarters are nice and soft. If you have a cow with mastitis, you often get a swollen quarter, and mastitis is very painful. And what happens is the cow often, when you go to touch her, what she does is she kicks because of the pain from the mastitis. So here's just a basic introduction to a clinical examination of the cow. The temperature is really important. If the temperature is 38.5, we know there is no infection present. So there's no reason to use antibiotics. If the temperature is 39.5 or above, then infection is present, and that's when you would consider using antibiotics. If you go to Fahrenheit, a normal temperature is 101 to 101.5, and if you have infection in Fahrenheit, it's 103 or more. So your temperature is really important when you're doing your examination. So as a vet, what I do is I listen to what the farmer says, and then the first thing I do is I'm going to actually go around and I'm going to take the temperature of the cow to establish if the temperature is normal or the temperature is raised. This cow's been really good. Thank you very much indeed. You're going to be a very famous film star.